The patella is most commonly known as the kneecap. It is a small, freestanding bone, meaning it is not attached to or supported by any other bone structure. It lies between the femur and the tibia. The patella and the muscles associated play an essential role for most motions that require movement of the leg. This includes flexion and extension. These movements allow us to perform daily activities such as walking, running, and jumping. A patellar dislocation refers to when the kneecap is displaced out of its normal alignment. When a dislocation occurs, the surrounding muscles and ligaments become overstretched and damaged. On the right is an X-ray of a healthy knee with no dislocations present. The X-rays on the left show various patellar dislocations. Picture A shows an inferior dislocation of the patella, whereas picture B shows a superior dislocation of the patella. The patella rests in a groove located at the end of the femur called the tonsillar groove. Often in a patellar dislocation, the surrounding bones, such as the tibia, the fibula, or the femur, are not affected by the injury. However, in some cases, small fragments of bone can be knocked off the patella due to the dislocation. This requires surgery. Muscles, ligaments, and tendons affected. Most dislocated knees involve injuries to the major knee ligaments. These include the ACL, the PCL, the posterolateral corner, and the medial or lateral collateral ligaments. In addition, there may be injuries to the medial or lateral meniscus. Patellar dislocations often cause tearing in these ligaments. Stretching of the quadriceps tendon and the patellar tendon is also often associated with a dislocation. Each of these muscles, ligaments, and tendons are essential for knee stability. A patellar dislocation may be caused by either a traumatic or an atraumatic event. An atraumatic event means there is no specific injury that has occurred. However, there are abnormalities in the bone or muscle anatomy. Possible factors include a wider pelvis, a shallow groove for the kneecap, a weak interquadricep muscle, or a misaligned patella. A traumatic event is when an accident has happened. Patellar dislocations are often a result of a direct fall or blow or sudden twist of the knee. Any extreme activity or contact sport can cause a dislocation. This type of injury is most common in high-impact sports such as football, soccer, or basketball. Symptoms of a patellar dislocation may present with the following: intense pain, feeling the kneecap shift or slide out of the groove, feeling the kneecap buckle or give away, hearing a popping sound when the patella dislocates, swelling, a change in the kneecap's appearance, meaning the knee may appear misshapen or deformed. Non-surgical treatment of a patellar dislocation can be divided into different stages. Stage 1, resolution of pain, swelling, and inflammation. This involves relocating the patella to its initial position and treating the kneecap with ice, medication, and elevation. Stage 2, recovery of joint motion and flexibility. This involves keeping the knee immobilized. This will keep the patella in position until the ligaments around it heal. To recover properly, weight bearing is not advised for about 3 weeks. Stage 3, recovery of muscle strength. At this stage, physical therapy is introduced, and it is important to build up the muscle strength and range of motion at the joint that was damaged from the injury and the immobilization period. Stage 4, recovery of motor patterns and coordination. This involves more intensive physical therapy to improve agility, balance, knee motion technique, and function. This will include running, squatting, hopping, and landing exercises. This enables a successful return to regular physical activity and sporting activity. This pathway of treatment is considered the conservative, non-invasive route for patellar dislocation treatment. Traditionally, most patellar dislocations respond well to conservative, non-surgical treatment. However, in some cases, complications arose from the dislocation may require surgery. Surgery may be necessary to repair significant bone or ligament tears or fractures caused as a result of the dislocation. A first dislocation can usually always be handled non-surgically. However, after the first dislocation, there is a 44% risk of a second dislocation, and after a second dislocation, there is a 50% chance of a third occurring. After every dislocation, it becomes easier and easier for the kneecap to dislocate. If a patient has a recurrent patellar dislocation issue, it is recommended that surgery takes place in order to stabilize the patella and the muscles, ligaments, and tendons surrounding it to prevent future dislocations from happening. After surgery, physical therapy is necessary for about 3 to 6 months to regain full motion and strength. Recovery time. In a non-surgical treatment plan, the patient is typically able to resume normal activity in about 3 to 6 weeks, depending on age, health, and severity of injury. The recovery time of a surgical treatment, full recovery with return to sports, is about 6 months after surgery. Whether a patient with a patellar dislocation has been treated surgically or non-surgically, both are required to participate in physiotherapy. The following exercises are given to patients recovering from a patellar dislocation by a trained physiotherapist. These exercises are given in order for patients to strengthen the damaged muscles, ligaments, or tendons surrounding the patellar region to prevent dislocations or further injury to the knee from happening in the future. The quadriceps contraction exercise is given to patients in order to strengthen the quadricep muscle. The wall slide exercise practices flexion and extension of the knees. These movements are essential for daily activity for tasks as simple as walking or sitting down. Shallow standing knee bends practices balance and agility of the knee. To further advance this movement, a chair can be removed once the muscles are strong enough without the extra support. These exercises promote a healthy recovery from a patellar dislocation and are given to patients by physiotherapists in order for the muscles, ligaments, and tendons affected by the injury are strengthened and to prevent further dislocations from happening in the future.